So I am just filming this with my
What are
phone
we
for
waiting
those
for,
of
Vicky,
you
here?
who
So we're
cannot
waiting for the machine
get
to let me
the
know that it's ready, and when it
recording
is,
on your
it'll
Dermapeer
probably tell me
account.
to remove the handpiece. And oh, usually we leave the old tip on so that we make sure that we have a new tip every single time. So what the machine is going to tell me, remove the tip and put the handpiece back in its little home. And once that's done, the machine will tell me to put the tip on. The card is already in the machine. There's a card for the Permia and a card for Clear and Brilliant. So we're using metal shield goggles today. We usually use, I think that the plastic, the little stickers, what was recommended in the theory part with Jessica. Today we're using these because she had some permanent makeup touch-up done earlier on, so we want to make sure that it's it doesn't affect that. And Anne-Sophie's going to start marking the face of the patient. We're creating treatment zones. We're going to treat forehead, cheek, second cheek, nose, and chin. We're doing a clear line here. That's where our treatment's gonna end. And are we ready to go, girls? Everyone's putting their eye shields on. I am doing it as well. We're gonna put the tip on and press the blue button. So we can see here that Anne-Sophie has a good pace because the light is blue. When the pace is not exactly what we're looking for, when it's too quick, you're going to see it go from blue to red. And you can also hear the sound. The sound's going to be accelerating as well. So you have a visual indicator and you also have the sound that gives you, and you're going to get used to that sound. I think everyone in the clinic is going to get used to it because we can hear it. It's not noisy, but it's a distinctive sound. So Anne-Sophie's doing clear, straight lines, doing a surpass if you would, or overlapping 100%. Moving on to the next line, making sure not to zigzag. So remember when Jessica talked about that thermal relaxation, so it's really important to let all of that heat go, and then before going over it again. So, is there any question right now? I wasn't there for the whole part of the theory, but it is simple enough, and it's also a very safe treatment. This is why we are very confident that even without a proper, let's say, hands-on training, at this point you'll be able to treat your colleague and be ready after that to start treating your patients right away with confidence. So I have a question here. I'm gonna go to, is Jessica still there? I know you had to leave us, Jess. If you're still there, you can read the chat. If not, I'll manage it on my phone. No? She's, oh, you can talk. Then yeah, go ahead.
Hi. We were just wondering, is she going over the eyebrow?
No, she's not going over the eyebrows. I'll show you from closer. It looks, I usually go over there, but not directly on the eyebrows.
And is it possible to show us what it would look like if it goes red at the top?
Oh, sure. Yeah, I can do a fast pass. Do a fast pass. So
Okay.
this wouldn't be ideal. Of course, you're going to see some red sometimes. It's really hard since the face is round, but mostly all blue. And it's there to indicate you that you have to just pick up the right pace. Could you see it?
Yes. We could. Thank you.
Pleasure. So she's just finishing her ACE passes. Moving on to the other side. And you have to pass over the white line, because if you don't, you will have a region who will not be treated. So you overlap the in-between. And with this treatment, there's a lot of redness after, and if you leave out a spot, clients or patients will see it right away, and sometimes this could add a little dissatisfaction to, it's not going to affect the results really if you have one white spot, but it's not what we're looking for. So at the end, when she finishes the face, she's going to look for those white spots that haven't gotten red and go over it. So make sure that these white lines, that the client doesn't end up with white lines, untreated lines where you're marking where it were. I'm going to show you what the screen looks like now, because we have to keep an eye on how much percentage of the treatment was being used. So those are the two things that you have to keep in mind. Make sure that you still have time, because I don't know if this was discussed prior to in the theory section, but you don't want to be using a second cycle. And if you have a card with 12 cycle on it, and you're too slow, and you lose sight of how much time is left for your treatment, then you might be consuming another cycle without knowing it, and that's going to mess up your inventory. I don't know if this is clear now, because you haven't managed the consumable part of this type of treatment. So a card comes in with 12 cycle, and this is what you're going to have to manage when you do your end of month inventory. So we have a little bit of redness, very good reaction. What are you feeling? I'm going to ask her in French. Our model speaks French. So. Comment tu te sens? Ça va bien. T'es pas fait mal? Pas fait mal. So she had the numbing cream on for a good 45 minutes, if not more than this. That's a lot. And she feels that it's very comfortable. And she's not known to be very tough in terms of pain. So I think this is a good sign. So we're doing a lot of Permeas in the summer. I personally really like this treatment. It's something that I call the no makeup summer look. If you want that glowing skin really quickly, to get a little bit of that those pigments off as well. I'm getting so much hyperpigmentation or sunspots in the summer. So we still have to be careful with hyperpigmentation. Ideally, you wouldn't put any sunscreen on, but when we do right after the treatment, just to let the heat go out and not to add too much product and avoid having those small white pimples that we can have. But hyperpigmentation is something you want to avoid at all costs. So it's gonna take precedent over the maybe small pimples that you might get. So it's important to know exactly if your client's going to go in their car, if it's sunny out, even if they go straight home. We'll probably in the summer make sure that we put a minimal sunscreen on after the treatment. But it's a really great treatment to be doing all year long. Also it's a short, it takes about 35 minutes to do a treatment. You might be booking an hour, 45 minutes, depending on what your setup is on an operational level. But it's fairly quick. Patients can be in and out very quickly. So we're doing we're doing a straight line as much as possible, just to end with a nice straight line. But you might want to go over this again at the end of the treatment, making sure that the finishing underneath is as straight as possible, just to give a nice effect and to reassure the patient that they've been treated evenly everywhere. Remember, you can't do touch-ups with this treatment. So if they think that you've missed a spot, you're going to have to use a whole cycle. So it's not possible. So it's just to avoid that. So we're at 63% now. 5 and 6. So we're going to complete with 7 and 8. So is there any question on how to position the treatment, how to combine treatments, when to do an original versus Permia? Is there any questions on this? Maybe I can add this. So I don't know what's your offer service like, and what other competing treatments you might have. When I say competing, so resurfacing treatments, and sometimes we want to maybe be careful and to make sure that we don't just start using this new technology because we like it so much, and then we forget about the other ones. So I don't know what you have, but also I think there's a place for every resurfacing devices or treatments that we have, and we have to also understand when it's time to move on to a stronger, not stronger as better, but something that's a little bit more ablative. And when people come in with acne scars, that's a good one. When should you recommend 5 to 6 Clear and Brilliant Original versus, okay, maybe if he needs more than 6, then I would recommend something else, moving on to Fraxel or something else. So this is also something to keep in mind as well. Usually our promos are for mix and match. So 3, you get 10%, 5, you get 20%. It doesn't mean that you can't recommend 4 or 6. Okay, you can do that. It's what you'll see often. So with our competitors or everyone out there is usually recommending 4 to 6. So we can still do that. We can do a nice 3 Permia treatments as a light, glow booster for the summer as well. So is there any questions in terms of how many treatments I should recommend? Comment tu te sens? Toujours? Ça va bien. Ah, still very comfortable? We are at 45% now. So Vicky is bringing on a good point. I'm going to turn to her and she can explain that to us. That's a very important point. When you're doing Permia or Clear and Brilliant, it's a different piece. So when you do unplug and change the piece at the beginning, you have to make sure the machine is completely off. So you can't turn it on and then say, oh no, you have the wrong hand piece, I have to change it. You have to turn it completely off before changing it on. It's a very good point. Otherwise, you'll get an error message, and it can break the machine. We don't want that.
For complete the 7 and 8 class. Introduction. You can always ask your patient to pinch their lips, even the upper lips, or she's doing it right now, and it gives us a better access, a smoother surface. So that's a good one when you start doing the treatment to be more comfortable. They might need a break every now and then because it's hard to hold it like this, but it helps a lot with treating just the lower lip and upper lip area, and even the whole chin area. It just really helps. When you see them shaking their lips, then you give them a break. And of course, the upper lip is usually more sensitive, but you don't want to avoid this area, as we know that those fine lines and wrinkles are showing up fast. So we're finishing the chin. We have 35% on our cards. We're really good at with timing here. So just a reminder that the next step after this will be practicing. We're going to do the upper lip here, so I'll get closer. To practice on a peer, so practice on, get a treatment, treat your colleague. It's really important too that you know, to engage your patient, you have to feel the treatment, you have to speak from experience. So make sure that you do that, and just connect with Jessica connect with Jessica once you've done this to let us know that you're up and running. And this doesn't have to end there. You can still talk to us if you need more advices. If you want to give us feedback, you can always write to training@dermapure.com. Don't forget it's dermapure.com. So we're doing the nose here. She's got a very small nose, but especially when you do the original, since we're targeting pores and texture, now we're doing hermia, but you don't want to leave this out. We usually have larger pores on the nose.